like to talk about sciatica and the way that I treat sciatic type pain with acupuncture. So there's typical two channels that sciatica will show up in. There's gallbladder channel and bladder channel. And sometimes it's a little difficult to differentiate which channel it's in. So the first thing is I'll ask the patient to very clearly with just one finger trace the outline of the pain. Because a lot of times people would say, oh, it hurts over here. And it's very difficult to get a very clear answer from them. So I make them use just one finger to trace the pain. And also I say, where's the very most painful point? Where does this pain start? With just one finger. And so that usually will give a clear idea of which channel. But sometimes it also switches channels. It'll start in bladder channel and move to gallbladder, or it'll start in gallbladder channel and move over to bladder channel. So there's a couple of things that you can use to differentiate which is the actual primary channel of that pain. Next, I like to check for movement restrictions. So I ask the patient, is it more painful if you twist, or is it more painful if you bend? If they're bending forward or reaching to touch their toes and it causes more pain that way, that indicates bladder channel. If twisting or leaning to the side causes more pain, that indicates gallbladder channel. So here's where it gets complicated. Anytime there is pain, there's also excess. Whenever there's excess, there's always a corresponding deficiency. If you just treat the excess tends to come back. But if you treat the corresponding deficiency, the excess is much less likely to come back, or it takes a lot longer to come back. So if you treat just the excess, maybe the patient goes home feeling great that day, next day the pain is back. If you treat the corresponding deficiency, they go home and they're good for 3-4 days, or maybe the pain doesn't come back at all, depending on how strong your treatment is. And so for gallbladder channel, the clock opposite is heart channel. And for bladder channel, the clock opposite is lung channel. And if you don't understand that, we'll have to use another video to get more in depth about clock opposite. So here's what you do. You pinch lung 7 gently, or just press gently on lung 7 and have them move. If that helps, then you know you're dealing with bladder channel. If you press heart 5 or pinch heart 5 gently and have them move, and that helps, then you know you're dealing with gallbladder channel. So what I would do next is set up a strategy where I'm both dispersing the problematic channel and tonifying the deficient channel. So if it was lung, I'll tonify either lung 7 or lung 9. If it was heart, then I'll tonify either heart 5 or heart 7. So if you want to get extra fancy, you can get yourself a magnetic tester like this one. It's just a north magnet on one side and a south magnet on the other. Then I place a small 800 gauge Acuband magnet on a piece of tape with north facing down on one and another one with south facing down, and I pick them up with the magnetic tester. So the next thing to do is to check extraordinary vessels. So I take my magnet tester and I use the pointy side and I place the magnet over gallbladder 41 and UB62. Whichever one of those gives improvement or the most improvement, again, that's your primary channel for treatment. So then you place the magnet. Usually it will be most effective on the same side as the pain, but sometimes you'll actually get a better result placing the magnet on the opposite side. The next thing is then to complete the extraordinary vessel, you do the coupling point. So there's one other scenario that I didn't really discuss, and that sometimes the sciatic will wrap around towards the front of the leg. I will just leave you one little hint about how I treat that one. I usually tonify liver 3. For more videos, you can check me out on Instagram, YouTube, TikTok, and my website, themastersharpeningstone.com. Okay, so just one last thought about the sciatica is, why not just treat both channels, right? Why not just treat gallbladder and bladder? Well, the thing is, if it's really only one and you treat both, you're dividing your resources in two. So the body can only take so many instructions at a time. It's trying to follow out those instructions using the resources that are available to it. But if you use 100% of your resources to correct a problem in the one channel that's actually problematic, you'll get better results than if you're using 50% of your resources in gallbladder and 50% of your resources in bladder channel.